Fibrinogen, one of my favorite markers, and really fibrinogen is a signaling molecule that simply tells your body that there's damage, and repair and recovery soldiers of our immune system need to be recruited to repair that tissue. So here's fibrinogen and fibrin stitching up the wounds, and so fibrinogen is produced in the liver. It's always floating around, but when it goes up, it means you have damage that's under repair. And if your level is higher than someone else, or on the low end, lower than someone else, either you have a lot of it could signal repair on either end of the spectrum. And high fibrinogen levels have been associated with heart attack and particularly stroke because it has a lot to do with clotting factors. Sedimentation rate, marker number 14. How the sedimentation rate test works. We draw your blood, we put it in a test tube, we wait 60 minutes and look at the settling of the blood. And if your blood settles, that means it likes to stick together. That's a clotting problem. I mean, we need a clot, but we don't want to have too much collection and stickiness in our blood. That's what can lead to an ischemic, a clot-related stroke. And the other thing about the sedimentation rate that's really interesting is that our body is an electrical system. These red blood cells should not settle. They should stay nice and buoyant in your test tube. Why? They are physical structures, so they should settle, but they should, in this instance, they should defy gravity because the electricity of the cell, every cell is a battery, creates a little negative charge, and these negative charges repel each other and keep it buoyant and up in solution. So an ideal sed rate value is less than 6 millimeters of settling over an hour, and really everybody should have a sed rate of around 2. Vitamin D, marker number 15. Vitamin D is not a vitamin. It was called a vitamin a long time ago, and we're unable to lose that term. But it's really a hormone, and hormones regulate cellular processes. So vitamin D is not really active, but it's stored. It's a fat-soluble substance. It's a fat-soluble hormone stored in our fat. So fat is important. We all need to have some fat in our body. But when we have infection, say, or inflammation, then our liver will recruit the vitamin D out of the fat and produce an activated form of vitamin D. And this activated form of vitamin D is what I really call God's antibiotic, and it helps keep infection under control, and it's clearly shown at the 55 nanogram per milliliter or above level to really quell cancer. And is there an upper limit? Probably around 120. It's very hard to get to 120 through supplementation or sunshine. So 55 to 120 is an ideal range for your vitamin D level. So here's an example of what goes on. This is an objective look at the value of sunlight on our body. And sunlight produces vitamin D on our skin. Our skin is our largest organ. So this is a map of cancer deaths of any type in the U.S. versus, so that's from the CDC. And these lines are from NASA. It's just how much sunlight is hitting the surface of the earth. And you can see where there's low sunlight, there's high levels of cancer. Interesting, in Florida, California, where there's a lot of sunlight, people are covering up with sunscreen and hats and clothing, and they're not allowing the production of vitamin D and other important molecules on their skin. That's actually all type of cancer preventative. They're worried about skin cancer. Now, melanoma is a serious cancer, but most of melanomas form where the sun doesn't shine. It's really squamous and basal cells, which are relatively benign compared to, say, pancreatic cancer. So I would suggest you get sensible sun. So as cancer deaths go up, as the sun goes down. So we want to go out and get sensible sun. We're made to get sun. Ferritin, marker number 16. Ferritin's a protein that stores excess iron. We have 3 storage systems in our body: fat for calories, ferritin for iron in case we bleed, our white blood cells slowly produce, or our bone marrow rather produces new blood cells rather slowly. So we have ferritin there to meter out new blood more quickly as we lose blood. So that's another type of storage. And the third is our bones, which store minerals. Yes, they are structural, but they also store minerals. So those are the three major storage facilities in our body. And it's really important that we have some level of iron and some level of ferritin. Obviously some level of iron, but some level of ferritin. But looking at ferritin can tell us a bit about anemia, but it can also tell us about our gut and are we absorbing minerals and iron effectively. So ideal value is between 40 and 150. The reason why iron is important and ferritin's important, but not having too much, is because iron actually promotes bacterial growth. So this is a picture of off the coast of New England and Nova Scotia, Georges Banks. It's the richest fishing ground in the world, and that's because the St. Lawrence River dumps very iron-rich water into this part of the ocean. And that iron, when the sun hits it, catalyzes algae growth, which is the beginning of the food chain. So excess iron will increase bacterial burden in our body. That's why we want to keep iron in check. And I recommend anybody with a ferritin above 200 consider giving blood. HDL. HDL is high-density lipoprotein. Notice it's not called cholesterol, it's called high-density lipoprotein. And this is from various journals, and what it basically says is that fat-liking substances or hydrophobic substances like cholesterol, triglycerides, vitamin D can be added to that. It's a hydrophobic or fatty substance. Vitamin A, fish oils, all these things are not soluble with water, so they have to be transported through our water-based blood system, our blood plasma, through lipoproteins. So HDL is simply a transport mechanism, or a taxi cab, if you will, for fat-like molecules that need to be brought somewhere to our tissue for metabolism, for anti-inflammatory properties, for a myriad of things that fats do. Our brain is 65% fat. We need lipoproteins to bring healthy fats to our brain. Now, HDL actually carries fat from our body back to our liver for recycling or for excretion. It's the LDL, very important, that brings the fats, the healthy fats, to our tissue for use. So an ideal value for HDL is between 51 and 90 milligrams per deciliter. So here's an HDL or an LDL molecule, or just let's call it a lipoprotein molecule. So here's our blood. This is the water-based system, and this lipoprotein looks like water on the outside, but it looks like fat on the inside. So the fats can get tucked away in here by a process in the liver through our gut. So this HDL molecule is now transporting the important fats back to the liver for reprocessing or discarding. The same is true of LDL. LDL is just carrying these important fats to tissue. And chronic disease temperature, CDT marker number 18, is the arthrogenic index of plasma. Not a lot of folks are using this yet, but this paper was published in the Mayo Clinic Proceedings by a group from Johns Hopkins, so two of the top medical providers in the country are using this marker. And what it is simply the ratio of your HDL value over your triglycerides value, and then they take the log of it to give you the so-called AIP. And they recommend it should be used in everyday practice, especially with persons with cardiovascular risk factors. It's a heart disease marker. Let's look at it. So what the Mayo Proceedings says and Johns Hopkins says, it's better, AIP is better than individual cholesterol markers. This slide might be a little confusing, but what this basically says is, particularly in older people, when your total cholesterol is greater than 200, your risk of early mortality actually goes down by 11%. That's what the 0.89 means. When your LDL is greater than 100 and you're older, your risk of dying early goes down by 22%. That's what the 0.72 translates to. But HDL, when your HDL is below 40, your risk goes up by 12%. When your triglycerides are above 200, your risk goes up by 18%. So how does the AIP track? When your AIP is greater than 0.24, your risk of dying sooner than later goes up by 29%. So the ideal value for your AIP is less than 0.24, and it's simply a ratio. The next marker, CDT marker number 19, is the filtration rate of your kidneys. And your kidneys are filters for your blood. And your kidneys are also very special devices. They're literally the pumps that control your blood pressure. There's 1 million little coffee filters called nephrons, million filtering units inside each kidney. And these microfilters, imagine if your coffee filter plugs up, you're going to have a spillover backwards. Or if you could increase the pressure, you could force liquid through this clogged filter. That's what happens in your body. Your blood pressure goes up because your brain, your other tissues, your muscle, your eyes, your heart, all need appropriate blood flow. So as the filter clogs up, pressure goes up to compensate for that. The kidneys also remove waste products from the blood, toxins, proteins, medications, but they also recycle substances of value. So for example, when a red blood cell leaves your body, the kidneys will pull the iron out to reuse. So it's the glomerular filtration rate, or GFR, and an ideal value is between 90 and 125. CDT marker number 20. We saved the best for last, right? But cholesterol, we use cholesterol as well, but we actually use cholesterol as a marker very differently than the standard of care. And here's from Harvard Health Publishing, Harvard Medical School, trusted advice for a healthier life. They say cholesterol in the brain, cholesterol is essential for human health. It's the building block for hormones, including cortisol, testosterone, estrogen. Look at this quote. Cholesterol is also an essential component of the membranes that surround all human cells. And they're not just holding the cells together, they're allowing things to pass in and out there. They create the kind of membrane that allows the cell to function the way it needs to function. You need cholesterol in your cells. So let's look at cholesterol from a mortality perspective. And this is from a study of 12.8 million adults, not done in the U.S. The U.S. is really fixated on cholesterol, so it's hard to get these studies from the U.S. Very little attention is paid to low cholesterol. So let's look at the curve. Hazard ratio, and this is a hazard ratio for all-cause mortality. In America, we are fixated on numbers above 200, particularly above 240, and we can see there's just really a modest increase in mortality as we go up. And it's readily explainable by a group at UCSF that's done a lot of work on this based on inflammation and infection, what I call the usual suspects. But no one in America is looking at the low end, and we can see that having low cholesterol is much more detrimental to health and creates a much higher risk for early mortality than having high cholesterol. And this would include cholesterol artificially lowered with any number of the drugs, including the statin drugs. So cholesterol is a risk factor for mortality, but particularly at low cholesterol levels. So to summarize, your CDT value, your chronic disease temperature, it reflects the average of all 20 of these biomarkers put into a single score. So you don't have the error from one or the other. We have the amalgamation of 20, and we have much more precision and accuracy when we combine multiple markers. As your chronic disease temperature goes up, so goes most or many of the other underlying 20 markers, as does your mortality risk. And we use a very simple scale. 98.6 is perfect health from our chronic disease temperature perspective. All the markers are in perfectly normal range. And as we go to 102 and 105, Think of 102 fever or 105, you're very, very sick. From a chronic perspective, your risk of early mortality coincides with this single number. So in terms of tracking your health, you're following a new health program. Is your health truly improving? Your chronic disease temperature is going to be the best gauge of that. If you're not in good health, what is your chronic disease temperature? That's going to tell you really where you are on the health disease continuum. It's going to be much more precise and accurate than any single or even multiple markers that are used in common practice like A1C and lipids and cholesterol values alone in today's medical care. I hope you find this of interest. I hope you order the chronic disease temperature. I'd have great pleasure in explaining the results to you and then working on a plan to help you improve your health, reduce your mortality risk, and improve your health span. Dr. Tom Lewis, thank you very much.